Hello, I'm Kimberly, and welcome to the weekend edition of the Native News Update. It's Friday, June 20th. Many of the stories you find here can be found at IndianCountryTV.com. And here's the news for the day from the Associated Press and other Native news sources. Congress is being asked to transfer more than 100,000 acres of federal land to Native American tribes at sites in northern and southern Nevada to provide space for housing, economic development, traditional uses, and cultural protection. One of the two bills submitted by Senate Democrat Majority Leader Harry Reid would transfer to several tribes almost 93,000 acres of federal land into trust for 7 northern Nevada tribes stretching from Elko to Reno area and grant more than 26,000 acres of federal land to the Moapa Band of Paiutes outside Las Vegas. The measure, called the Nevada Native Nations Land Act, is co-sponsored by Nevada Republican U.S. Senator Dean Heller. Heller called it a much-needed step in the right direction toward providing both jobs and independence for many individuals and families of northern Nevada's Native American tribes. The Lower Elwha Klallam tribe has earned a Washington statewide award for its environmental education and sustainability. The tribe will receive the E3 Washington President's Award at a ceremony June 26th in Seattle. E3 Washington, which integrates education, environment, and economy, has been the professional home for environmental and sustainability educators since 1990. The E3 Washington goal is that every place, be it a building or other site, becomes a learning laboratory for the shift to sustainability. In the case of the Lower Elwha Klallam tribe, multiple sites under its management meet this goal. The tribe was nominated for one of 3 E3 Green Apple Awards by retired teacher Mary Mars of Port Angeles. She nominated the tribe mainly for its commitment to the Elwha River Restoration Project. A resource center meant to improve American Indian public health programs is targeting Midwest tribes that have diseases and death rates much greater than the general population. The American Indian Public Health Resource Center will assist tribes with health promotion and policy, disease prevention, technical work, and grant writing, among other things. Its director, Dr. Donald Warren, said the Indian population in the Northern Plains has some of the worst health disparities in the country. In North Dakota, the average age of death is nearly 76 for the general population and nearly 55 for American Indians. Warren came to Fargo, North Dakota to start a Master of Public Health program at North Dakota State University, which features the only American Indian specialization in the country. Warren said the program will allow officials at each tribe to tailor their health programming for their specific needs. The center is being funded by a 3-year grant of more than $1.4 million from the Leona M. and Harry Hemsley Charitable Trust and $720,000 from the North Dakota Higher Education Challenge Fund. After 30 years as a school principal at Two Eagle River School, Clarice Charlo King received the Confederated Salish Kooteni Tribal Education 2014 Lifetime Achievement Award. King began her role as not merely a principal but a mentor and a mother figure to hundreds of students and concluded her career like a grandmother to several more. When she retired in 2012, King had students graduating that were children to those who first graduated when she began. King was born in 1942 to Margaret Pablo and Clarice Charlo and the descendant of Chief Charlo. She was raised also by her grandparents, Louis and Abel Combs, whom she said taught her respect, dignity, and humility, and to nurture others. She was an original member of the launch of a reservation-wide education committee that eventually developed into Two Eagle River School. She was also active during the time on the committee that was birth of Salish Kooteni College. This week in history, Suzanne Flesche Picotte, the first Native American woman physician in the U.S., was born June 17th in 1865. She founded the Picotte Memorial Hospital, which was built in 1913. The hospital, located on the Omaha Reservation, was the first hospital for a Native American reservation not funded by the U.S. government. Flesche Picotte went to college at the Hampton Institute and in 1889 got her medical degree at the Women's Medical College of Pennsylvania in Philadelphia. She worked in Nebraska providing health care to her Omaha people for much of her career. After Picotte died on September 18, 1915, the hospital she founded was renamed in her honor. Later it was designated as a National Historic Landmark. Today it serves as a museum featuring her work in the history of the Omaha and Ho-Chunk tribes, and also has a center for the care of children. And that's another roundup of news from Indian Country on this edition of the Nave News Update. I'd like to thank you for joining me, and have a grand day.